Dave, Rob, thanks for being in 160 Studios today.
Delight to be here, just a delight.
Appreciate it. So this will be one of those geek out sessions for me because typically I'm talking to entrepreneurs, startup people, and the large strategics, but the industry may or may not know I'm an engineer at heart. Undergrad in engineering and worked as an engineer for a number of years. And when something goes sideways was always my most fun. We were chatting about that before the cameras came on. So Rob, you and I were out at the MDM show.
Yes.
And we do work with stress engineering with your firm, right?
Yes.
Would you just share with the audience a little bit about what your firm does?
Yeah, so we're an engineering services firm focusing on supporting the large multinationals, probably 80% of our revenue, and we're really an extension of their organization. So we build our labs and we hire the same kind of folks here, but driving towards deep expertise in supporting them as projects progress through and working on either new product development or helping them in sustaining engineering issues or helping in failure kind of issues.
Got it. Dave, your background?
Engineering to begin with, chemical engineering, but up through industry, mostly running programs and then running R&D groups, putting out products in medical devices from combinations to standalone devices themselves.
Great. And then, Rob, when we were chatting at MDM, one of the things you said to me, and it made me pause, it was, are you sufficiently paranoid?
Yes.
When you're developing a new product? So
Yeah.
what do you mean by that?
Everybody likes to put together their plans, and they spend a lot of time early on in the project putting together their plans. No one has uh-oh in their plans, and 100% of projects have that. And it's really about your ability to identify those and solve them, or more importantly, do you have a plan around recovery? And we find that those things are generally not in anybody's plan. And so, I started the first, 10 years of my nearly 20 years at Stress Engineering just dealing with those. And so you then develop some perspectives around this. And we're seeing that there's a lot of folks that are leading projects for first time and they just haven't been burned enough to be sufficiently paranoid. So when I'm engaging a client, I'm not asking them directly, but I'm trying to determine, have they been burned enough? And if they have been burned enough, then the conversation is a little bit more advanced because they get it. If they haven't been burned enough, then it's really about educating them about, hey, these are the things that are generally going to bite you in the long run here. So how do we manage that today?
As medtech in particular becomes more and more specialized, we're seeing that, right? We're getting down into a very narrow domain expertise more and more often. And with that relies on some, I would call it on one side an expertise, but on the other side, you can get caught up in this cognitive entrenchment, right? You can think like, I'm a domain expert, I know everything there is. And sometimes that can limit your ability to consider other things outside of medtech for that matter. Has it been your experience that medtech tends to be insular and we only hire medtech people in medtech, yet there are so many potential things to consider outside of medtech that other experts can bring in?
Well, that's really a huge point, Joe. If you look at hiring engineers in medtech, one of the things that's required in every job description, job application is must have medical device experience. And what that means is we're just recycling the same people, so the same ways of working go from company to company to company. Everybody's got basically the same pedigree, but that causes everybody to act the same. They're very process-oriented over outcomes or results orientation, so they don't think about problems deeply enough and don't anticipate problems. Even practices that have become, just routine in other industries haven't even broken the surface. I've got a good friend that says the future's already here, it's just not evenly distributed. Well, a lot of it has not been distributed to medtech yet in terms of engineering practice.
What have you seen in medtech that seems to be serially some of the same issues practices go to in the problems that you've been solving?
There's a heavy focus on compliance. And compliance is important in many industries. And I have colleagues in stress engineering that work in energy, that work in aerospace, that work in medical, work in pharma. And it's interesting when we look at the class of work that they all do. There is a heavier reactionary behavior in the med device and pharma industry where I'd say oil and gas or energy or aerospace, that they can't prototype. Some of these things you just can't prototype. So they go right to the engineering. And so my colleagues there, I call that really hardcore engineering, right? Where the dosage of hardcore engineering in the med device space is, I would say, way less. And the other thing that I see is as being a very, very conservative industry, things they're doing today, I've seen in the consumer products industry when I started 20 years ago.
Mm-hmm. Is there a rationalized compliance mentality or an unquestionable, here's the playbook, this is the way we do it, this is the way my sort of mentor did it and taught me, because I knew that. Mine was Seymour K. When I was an engineer, I would run down to Seymour's desk when I had an issue with one of the electro-optical systems we were working on, and I'd sit with Seymour, and he would tell me what he knew, and then I'd run away, and then I would just propagate that to the next generation, who then followed me. I never stepped back and said, here, we jumped too quick to here's the problem we have to fix, versus taking more time to understand the problem.
And also to understand the survey of potential problems. MedTech, we still don't use systems engineering, which is really the anticipation of the things that we're going to see. Instead, we wait until it's like planning by stepping on a rake. Bang, we get hit in the face, and it's like I just got born yesterday. I've got to fix this problem. There's so much that can and should be done, but we have adopted compliance to such a great degree that we'll follow the playbook before we'll solve the problem.
So this ran outside of medtech, right? So we looked at, let's look at the Columbia accident for a second, right? So tragedy for sure.
Yeah.
But the Columbia Accident Investigation Board concluded NASA's culture emphasized chain of command procedure, following the rules,
Yes.
and going by the book. While rules are essential for coordination, they had an unintended negative effect. That was the report. And allegiance to hierarchy and procedure had ended in disaster. That could be written about the medtech industry, couldn't it?
There's the same pattern in almost every failure. It's usually, it's interesting because they want to do root cause analysis, and cause with no S at the end. But it's usually root causes. It's a summation of events coming together, right? And you'll read it in the paper, this tragic accident, this freak accident, because these several things that have come together, they all follow the same pattern, right? And you watch it. I don't care if it's an airplane landing too early in San Francisco. I don't care if this is an issue with a ship out on the ocean, or it's a med device failing or not delivering a drug or whatever. They all follow that same pattern. And so it's looking for those things to come together. And so, our clients, one of the things that they're driven by is schedule, because they're making commitments and things like that. So schedule is paramount. So they push things through and to get it across the finish line. But they are not sufficiently paranoid to go look for those 4 Sigma or 5 Sigma events when you start scaling up that actually come and get you. And some of these life-saving products have very high requirements, and yet they get to the market, and you could read about it, the issues, that all the recalls.
Let's talk about that for a second, because my world revolves around the startup world. I'd say 80% of our business over our 30 plus years in search is emerging tech startups. So when you think about an emerging tech startup, you've obviously got the engineering component, and then you've got the quality component, and then you've got the regulatory component. Let's just keep it there for now. And the quality component historically has always been told by the CEO, we need a quality system in place, but it's got to be enough to get us through FDA clearance or approval, but it can't choke us down. And when you're in a startup, you generally have an N of, depending on your clinical trial, and the clinical trials tend to look at the outcome on the patient for safety and efficacy. And sort of enough around GMPs, good manufacturing processes, but nobody really digs into the design. Certainly materials are an issue. Okay, got one of those. But when you look at the pure design, nobody's looking at that for the black swan event, or going from an N of 100 to an N of 1 million. Oh, and by the way, you did your trials in 3 sites in New York, Boston, and Miami. But now we're selling the product in China, India, the Arctic, I'm being a little obscene here, but temperature, storage, travel, and just the pure numbers change. How do we guard against that?
So in the startup world, we tend to work with the large multinationals who acquire these technologies, and it's in pharma and med device. And it's almost always the case that those systems are not robust enough for the large multinationals in terms of what they accept for risk. And so, you're often, then they're going through and they're saying, well, how do we get this to the standard? And often, I always advise my clients in saying, hey, what you're buying is something that embodies IP. Don't consider this a finished good. If you do, or a finished design, you're going to be disappointed, because they can't get enough money to do that kind of work. Only the large multinationals really can afford to do that. The startups, they just got to get out there and show there's a market. And so, there's a due diligence play, that we're often involved in when people are looking at technologies, and we go look, you go do the due diligence as someone who's been there and done that and just seen a lot of issues. You're like, okay, well, that's missing, that's missing, that's missing. It doesn't mean it's a problem. It just means that risk is not fully retired.
Right.
Dave, what has your experience been in that area?
Exactly the same, Joe. And it's doing things on a small scale is so different than doing it on the big scale, and that these things are unknown often is taken as, well, they're just unknowns, but you have to distinguish between what's unknown and what's really unknowable, and expand the range of what we can find out. And the startup, okay, we're looking to get to market. We often subordinate the technical development to being able to do the quality system, because it has to be acceptable to whomever would buy us. But in the due diligence, as Rob says, that's the responsibility of the big organization to look at where it's going to go. And oftentimes we look at what's already there. We don't look at where it's gone. I've done a number of acquisitions, and we all follow the same playbook for looking at this, looking at that, but not saying, how will this go to India? How will this go to over the Rocky Mountains or the Himalayas? We don't think about it in the broad enough scale, finding out the things that are knowable, but we're treating as unknowns and unknowable.
And what's interesting, if you think about some of the, well, J&J yesterday paid $9 billion with a B on the talc issue, right? So they couldn't duck that. And so that's not necessarily a device issue, but there are other device issues, and we'll leave them unnamed here on whether it's respirators, whether it's LVADs, across the board. What's been your experience on where those, oh shit, I missed that moments occur in that process for our viewers?
I always look at the individuals that stress, and I always wonder what their natural curiosity is, what they talk about. My curiosity is why do I see the same things over and over again? And so I just started collecting information on every time something would come through. After the project was over, I'd call the client and say, well, how did we get here? And really, I've narrowed it down. One of them is a little bit newer, but I've narrowed it down to 4 things. And the number one thing is I didn't know I needed to know that, all right? That is so common. And a lot of these companies have very young staffs, very smart people, but they just haven't seen enough. And that's where really consultants come into play, because when you're a clearinghouse for problems, you're going to go, oh, you could probably grab more of those. That's number one. Number two, probably a strong reliance on supply chain. And I'm a big fan of using the supply chain, but I think it's important to recognize what their strengths are. They're manufacturing experts. They probably understand mechanics. They probably understand materials. They maybe understand human factors, but they're not experts. And so if you superimpose all those expertises on them, you will be disappointed. That's the second reason. The third reason is the constant reinvention of the wheel. They're not seeking the folks, so they're going up these learning curves, and they're not taking advantage of the mature information in the market today. That's very common. And the fourth thing, which really goes to timelines, rapid prototyping. Rapid prototyping is wonderful, but it also doesn't make you sufficiently paranoid. It gives you a false sense of security. It works. And when I look at, if I had 500 of these come through the building last year, 490 of them would fit in one of those 4 categories. And so you just need to be aware that's happening. And again, if our clients saw as many problems as we did, they have a different problem. They just don't know. And so that's half the battle, is just being aware.
So how does that solve? You would share with me some interesting notes, and I want to get this as right as I can, is make, buy, rent to own, partner. So where does that philosophy come from?
Well, in trying to set yourself up for success, people have a make or buy sort of attitude in medical devices to how they get their people. So we're either going to make them, develop them out of the people we have, or we'll hire them from somebody else. But the infusion of new ideas, new talent, the ability to go deep when you need to go deep, and to be able to see a broader, bigger future means, okay, well, let's rent, and that's often going out and getting a consultant or a contracting agency. One I like a lot is renting to own, where you get somebody who's a specific expert in a specific area, and you bring that in and become to own what they've taught you. Learn from the consultants and embed that new talent, new expertise in your organization. And then the ability to partner. MedTech is really weak at technical partnering. If you look at aerospace, I think you came from aerospace, but nobody builds a jet by themselves. Raytheon does the radar and avionics. There are probably 8, 9, 10 top line firms involved in making any jet. Well, in medical devices, it's the originator, which might be a startup, and then it's the big company. And that's it. And nobody, they're very, very insular, so they don't ask for help. They don't go look for stress engineering. In fact, I wish I'd known Rob 25 years ago, and life would have been much simpler. But having come to know him, it's, renting to own expertise like Rob's is extraordinarily important. And coming around with more strategic relationships with people like Rob's organization can cause those problems not to happen, or if you do have them, they get solved quickly.
Yeah, you had mentioned something earlier when we were chatting, and we see it too, and you see it too, is most executives I work with will be at 3 companies, 4 companies, in their 30, 35-year career is about the average. So they see a subset of 3 or 4 problems.
Yeah.
Invariably, after 8,000 successful placements with 700, 800 companies in 15 different vertical domains in medtech, you get to see a lot of stuff.
Yeah, absolutely.
And you can sit there and go, it's like watching the kids, like, watch, here he goes, he's gonna fall, right? You can spitball it every single time.
Yeah.
It's gotta be the same in your seat as well.
SSDD, same stuff, different day. And yeah, those patterns definitely do exist. And so it's really about making them aware of those patterns. And it's really about the conversation of and, not or, because they're like, well, should we do this or should we do this? And I'm like, no, make it an and statement. You, at least from an advising standpoint, you want as many different points of view as you can so that you can make decisions. Because the higher you go in these organizations, what you really find is they're lonely. And there's a lot of weight on their shoulders. And how do you take some of that weight off and provide that confidence to be able to move forward, that they're making the right decision? So, so they don't repeat the pattern, right? Make them aware of the pattern. This is what's going to drive these things here. And, and often, almost, 99% of the time, they'll reflect back at me, oh, you're right, I've seen it. They just weren't thinking about it in that way because they probably don't get the reps at seeing it as much. Like, as you described, oh, watch, the kid's going to fall.
Yeah, well, you can see it coming. We were chatting also about combination products. So invariably, in our role, we do a lot of work with combo companies. And let's just say I've got a drug delivery company, and their primary competency is the drug. Their secondary competency is the delivery mechanism, a pump, an infusion pump, or whatever it is. And invariably, the device guys or girls have to sit at the children's table. And I know you guys who are in device, working for a pharma company, know this, so you can snicker. And then the pharma companies can say, no, that's not true, but that's not true either. So they sit at the children's table, the device people, and the drug people run the show.
Yeah.
But when the drug is ready, the drug's ready.
Yes.
Because we're talking about billions of dollars.
Right. Yes.
Right? Is the device ready, or has the device been vetted enough oftentimes? And I find that those devices tend to come from contract manufacturers that you just said a couple minutes ago are good at making that because it's the way they've always made it. Now, when you start to change volumes or characteristics of the drug, what have you, you start to have performance issues. Have you seen, either of you or both of you, challenges in combination devices that could be mitigated if pharma would give up some control or not rush something through?
I would say there's definitely opportunity there, and but also I would drive towards awareness. What you see with those device companies, again, they're in a race to get revenue, right? So you're going out there and they have to get someone to buy this device. And so it's just like a startup on some levels. Some of those behaviors are very similar. You know, some are more mature than others. But what I also find is they're loaded with a lot of tribal knowledge. So they understand if you're operating in this window how it's going to behave, but this new drug comes along and it's over here. And so they try to project, but they don't get it. And I would say they, again, very talented people, very smart. You know, they have way more reps at it than I do. But they don't fully comprehend all the requirements. And they're like, well, we'll test for that. Well, we'll test for that.
That's going back to that compliance mentality.
Yes.
Versus performance mentality.
Yes, and I think that if you took a different approach to this, that you treat it as being knowable, and you treat everything as being knowable, it may be perceived as a little bit more work up front and not as fast, but in reality is always faster.
Mm-hmm. Yeah, net at the end of the day, and the punishment usually is less severe when something does go wrong.
Earlier.
Yeah.
Yeah.
Right. Make it go wrong by design. And I know people will be here like engineers, like, oh, we test it all the time for failure, right? Well, in a startup, you don't have the resources to test it as comprehensively as you do when you're in these large multinationals.
And you know, Joe, test is kind of a trap. As Rob was talking about the rapid prototyping, it looks too finished too early. And so we've got this thing that looks finished, let's make a bunch of them and test them. But so many things are knowable through modeling and simulation, which is really slow to come to our industry. And things that are knowable, we can test, you know, the cliffs of fitment. We can test the cliffs of whether something's going to break or not, and we don't even have to test them. Oftentimes you can't make enough with enough manufacturing range to test into the range it'll see later on where it will break. So, you know, moving things like modeling and simulation expands what Rob talks about in the knowable domain. Things are knowable, but we've got to act like it.
Well, do you run into this too, is when somebody comes in with a failure and they'll take their pen, they'll say, here's our test data, right? So that's almost a survivor bias type approach. It's like, here's the data. I'm like, well, the answer's probably not in there clearly. It's something else you weren't aware of.
Right.
Right? And that's where you seeing a lot of reps and a lot of oops comes invaluable.
It's beyond. I mean, so though, you know, in the age of teams, they'll say, well, this is our problem. They'll show it to me, and I'll say, well, give me a second, and I'll flash something on the screen. Does it look like this? They say, how'd you know? It's my job to know, right? Because you become a clearinghouse for these things. And I remember getting into this business. One of the, I'll call him a partner emeritus. His name was Doug Marriott, and passed away just during COVID. But he was a mentor to a lot of us. And I remember getting my first failure project, and I'm diligently writing down the notes. And I'm 27 years old, and I hang up the phone, and I go, what am I going to do? And Doug, so part of the indoctrination process as stress is you had to sit across from Doug. And so Doug comes roaming across, and he says to me, Rob, there's no such thing as a new failure. Your job is just to collect them and recognize the pattern, and more importantly, remediate them. Our clients will spend a lot of time hitting their head against the wall, trying to solve these problems. And the ones we get are the ones that someone told them to go ask for help. And my wife reminds me all the time, engineers are reluctant to ask for help. But when they do, they call. So all you get to see is that, right? And so you see them. And you think of something as simple as a stopper in a glass vial. You would think that that's fully mature. We see one major issue a quarter with that.
And that sort of legacy product that's been around for 100 years?
Yes. 3 components. And we see one major issue a quarter.
Wow. And
from, you name them, most of our revenue comes from the big guys, right? And so it's finally getting to us, and they're saying, well, what's going on here? And so when they hand you the test data, you're correct. I may look at it, but my approach is to go to the model and to go and actually understand the first principles that actually drive how it works. And then look at the data, because if you have that and you match that with the data, you then probably can see exactly what's going on.
So I'm going to come back to the startup world right now. And I watched this happen, acquisition after acquisition. Startup comes out. People are passionate about it, great thinkers. And we talked about some of the challenges there. An N of 100, eventually it's meant to be for tens of thousands. So we've got that dynamic. Big strategic comes in, acquires a technology, a complex technology. Let's make it really complex. Let's make it a surgical robot, soft tissue surgical robot. They come in, the big strategic comes in, buys out the $6 billion platform. All the tribal knowledge goes, cashing my check, going off to my next startup because I'm not going to work at the mothership. It's just not what I'm wired for.
Yeah.
Now you move this incredibly complex platform to where it was not ideated, nor made, nor people didn't see the problems. What hornet's nests appear in there from your experience?
Well, what was number 3 reason for failure is the reinvention of the wheel. So they have to go up the learning curve on a lot of those things there. I mean, that is probably, you're going to spend a lot of time doing that. And then they're going to really start to understand that when I scale this up, or they start introducing variability, because you'll find that those parts were blueprinted. You know, that's an old, engine term for creating more horsepower, right? You find those parts were blueprinted. They didn't really look at what the process capability was on these. And so they start discovering all those little nuanced details that drive into the reliability. Or, as simple as, depending on the mechanism that actually drives the robot, they got to get, some number, 50, 60, or 100 uses out of it. They have to go through these, cleaning and disinfecting processes. And does that actually cause things to move on you? Do you actually lose control over time? What's the accuracy over time? And they start losing that when they start putting variability in there. Did I pre-stretch that cable or not? How will that behave? And, that's just, it's SSDD, same stuff for different day. You see these things here, and that you have to jump in and really then try to build mathematical models around this. And if it doesn't work on paper, it's not going to work in real life.
Your experience in those areas, because you've been on both sides.
Yeah, Rob's got it really nailed. One of the things that has frustrated me over the years is the lack of technical due diligence in the business due diligence of acquisition. So the BD guys go in, and the BD guys and the technologists talk, and it looks like the market's there, looks like all these things are there. But the technical due diligence is usually one of the last things that occurs, because it's under the kimono, exposing all the IP. If you're going to do that, you're pretty much committed to the deal. And if you're not committed to the deal, you're not really not looking for problems. You're looking for, is there anything here that is going to go off on our hands, or can we just say we've covered the technical due diligence part? Technical due diligence might be done by a couple of technical directors, R&D directors, who haven't been on the bench in a long time. They haven't done any modeling in a long time, and they don't see enough in the startup's history to say that they've found any problems. So it's easy to say yes, and all the momentum is toward yes. And it actually goes to your Columbia NASA issue, where it used to be called Go Fever. There's a significant amount of yes that's built into the system, but there's a lack of bravery to say no.
Yeah,
we're not ready.
Yeah, and in that Columbia issue, when they interviewed all the youngins, they were screaming the alarms.
Yeah,
but they were afraid to scream it up top for fear of losing their job or getting their bonus cut or embarrassing the chief engineer sitting at the table, where they were like, no, this is going to be an issue.
Yeah.
So that's a CYA situation here that still exists today in all industries.
Well, one of the tragic things is that the same finding was done in the Challenger disaster many, many years before. People knew there was a problem at a lower level, and it couldn't evaporate or couldn't get bubbled up to the top.
Yeah. Let me give you a couple statements here as we wrap this up, and it's like a quick lightning round, and I just want to get your thoughts on it. Relying upon experience from a single domain is not only limiting, it can be disastrous. Comments?
Absolutely. Yeah. You've got to know what you're going to face, and you can't do it through one lens. You've got 7 or 8 cameras in the room here. You're trying to get a lot of angles. If you're not looking at a lot of angles, you're missing a great deal of what's going on.
There's a lot to be learned from other industries who have been there before you.
Yeah.
You should learn from them. In matter of fact, you can look at, this industry does this well, this industry does this well, this industry does this well. Go study that.
Yeah, that's actually a great point. We've talked about a lot of times is, against whom are we comparing ourselves? In medtech, we often compare ourselves to other medtechs. In consulting, people will ask me, well, how does company B do it versus company A? And that's really the wrong question. How do the best in the world at this particular type of problem do it? Compare yourself to the best in the world, not who happens to be up and down your boulevard.
The labs in which scientists had more diverse professional backgrounds were the ones where more and more varied analogies were offered, and where breakthroughs were more reliably produced when the unexpected arose.
The metaphor, being able to think in metaphors and apply them across a whole scheme. Diversity is huge in the thinking.
As a young engineer, my first job out of school at Procter & Gamble, they send you, all the engineers, to training for a week. And then they show like a scatter plot of some sort of experiment. And everything's in line except for this one point over here. And that's what their business was built on. Understand that.
Each, as man amasses more information for his own view, each become more dogmatic, and the inadequacies in their models of the world more stark.
We know what we know, we don't care to know what we don't know.
Yeah, isn't that true? We're a lot more of what we don't know than what we do know.
Yeah.
And that gets us in trouble.
You don't know what you don't know, which is the number one reason why something occurs, right? So surround yourself. The reason that consultants exist is not to replace your staff. They exist to augment your staff and use them in that way because they have those experiences.
And that's really important. We're both in service businesses here.
Yeah.
And I can go ahead and watch a train wreck occur on a staffing issue, building a small team, the selection of the lightning rod hire, as we call it, to lead that team. And that person has one or two terminal behaviors. And that's what we, as a headhunters, we look at curable and terminal behaviors in human beings. And when we see somebody entering into, and I just wrote an article recently about a big company, and the leader is a great person. However, they were a great person in another domain, and they didn't know the problems they were about to face, yet they were the head of the snake, respectively. And I think organizations need to go out and buy the insurance policy, and this is not self-serving or unbiased, is buy the insurance policy of somebody else who has watched train wreck after train wreck after train wreck before you go ahead and pull the trigger on some massive adoption of a technology or a skill set.
I borrow this phrase from someone, a mutual friend, and he would talk to a client and he'd say, you have homeowners insurance? Yes. Do you have insurance for your project? No. Well, the odds of your house burning down are much lower than the odds of this project going wrong.
Right. And then, so how would you define insurance policy there?
Well, it's really, again, around the strategy of recover. You will need to recover. I work with the largest companies with the biggest budgets in the world, and they all have massive problems. It's, you need to be conscious about a strategy around recovery and how you're going to do that. And, an example of this is, I was working with a client, they were doing concurrent engineering on a consumable aspect. It was a diagnostic equipment and the capital equipment. And so these were independent groups working to some sort of specification. And but when they went and put it together, it never worked as anticipated. My job was just to be there and fix that. Just know that's going to happen. The interface control documents are insufficient. They were defined before you made anything. And so this client, sometimes our clients see things in us faster than we see in ourselves, and now it's a thriving business for us. But that particular client was sufficiently paranoid, and they're like, when this occurs, I want you to take care of it, because they can't pull their staff off. Their staff is already busy, and they're the ones that know the most about the product. So that you can't pull them off and substitute that.
Yeah, and they're already blinded to what they know.
Yes.
Right? Because we have that all the time. We've had people come in, well, look, it's Occam's razor.
Yeah.
I'm like, well, I didn't see that, so it couldn't have been Occam's razor, the most obvious. Yeah?
Yeah.
So Dave, Rob, I appreciate this. I mean, I'll rip on all day on this one because I'm geeking out on things going sideways and then fixing them. And I think that's something all three of us have in common, is we love when shit goes sideways and we like to be there to fix it. What would you leave our audience with as a parting statement?
Look broadly, think deeply. find the best in the world to help you. You don't need to look inside your own four walls. If you are, they've been there too long, go get help, find the best.
Very true.
Just surround yourself with people that have been there and done that. No matter where they come from, that will minimize the need for recovery.
Well, this has been a fun one for me. I'd like to thank my guests for coming in today. Appreciate it, gentlemen.
Thank you.
Our pleasure.
Got it. I'm Joe Mullings from 160 Studios. Be well.